Ever find yourself looking for that career sweet spot? Something that really makes a difference, keeps you thinking, and pays well.
It's a pretty common search, right? Finding that balance.
Exactly.
Yeah.
Well, today we're doing a deep dive into a part of healthcare that maybe doesn't always get the spotlight, allied health professions.
Yeah, they're sort of the unsung heroes sometimes.
Totally. So our mission here is to dig into the sources you provided us, pull out the key insights, and really highlight the top-paying jobs in this vital field for looking ahead to 2025.
Yeah.
And just so you know where this info is coming from, we're working with solid stuff. Latest numbers from the U.S. Bureau of Labor Statistics, input from professional groups, top healthcare job sites.
Right. It gives us a really current picture.
It does, all feeding into this look at the top 10 highest-paying allied health careers in the United States for 2025.
And maybe we should start with, what is allied health? Because it's broad.
Good point.
If we connect this to the bigger picture, it's a really dynamic, essential part of the whole system. Covers a huge range of specialized jobs, people supporting diagnosis, therapy, patient care, just everything around the doctors and nurses.
And it's growing fast.
Oh, absolutely. You see it driven by, things we all know, the population getting older, amazing new medical tech, more people getting access to healthcare. It's just creating a ton of opportunities.
And what gets me is the mix in these roles. You often get that direct patient contact, but also this really high-level technical skill. And like we said, the pay can be surprisingly good.
Exactly. It's a fascinating combination.
Okay, let's unpack this list then. Ready to explore some pretty intriguing career paths.
Let's do it.
All right. Kicking off our countdown, number 1, the highest paying on our list, perfusionists.
Ah, yes. Critical role.
Absolutely. These are highly trained pros operating heart-lung machines, other, advanced gear during cardiac surgery. They're basically temporarily taking over the heart and lungs job.
It's intense. What's fascinating here is just how critical their work is in these really high-stakes surgeries. Imagine them during a bypass.
Right.
They're constantly monitoring vital signs, managing blood flow, making sure the patient's getting enough oxygen. Minute by minute, second by second adjustments.
Wow. That sounds incredibly stressful.
Yeah.
So what's the path to becoming one? That kind of real-time pressure must take specific training.
It is demanding, no doubt. Usually start with a bachelor's degree, science-related typically. Then you need to complete an accredited perfusion technology program. That means a lot of clinical training.
Hands-on stuff.
Very hands-on. And then there's certification from the American Board of Cardiovascular Perfusion, the ABCP. Plus, some states require their own license, too.
Okay, so rigorous training. And the payoff. What does the compensation look like?
Reflecting those specialized skills and the high stakes, average salaries are usually between, say, $150,000 and $200,000 a year.
That's significant.
Yeah, and experienced folks, especially in big cities, can definitely earn more.
Okay, from the intensity of the OR, let's shift gears a bit. Number 2 involves a different kind of precision, focused on cancer treatment. Medical dosimetrists.
Right. These professionals are a really key part of radiation oncology. They work super closely with the radiation oncologists and medical physicists.
So what's their core function?
Their main job is designing and calculating the exact radiation treatment plans for cancer patients. Think of it like planning a targeted strike. They need a deep understanding of anatomy, physics, and some pretty advanced computer software to make sure the radiation dose hits the tumor effectively, but crucially, safely avoids healthy tissue. This raises an important question about how they balance that power of the treatment with keeping the patient safe.
That sounds incredibly detailed. How do they get that expertise? The anatomy, the physics, the software?
It takes serious education, usually a bachelor's degree to start, then a specialized dosimetry program. And they need certification from the Medical Dosimetrist Certification Board, the MDCB. And you find many of them actually worked as radiation therapists before, so they have that practical background too.
That makes sense. And the salary for that level of detail?
It's up there. Median salary ranges from about $120,000 to $150,000 annually. Really underscores the responsibility and technical skill involved.
Okay, number 3 on our list, pharmacists. Now, I know sometimes they're seen as separate, but they often pop up in allied health lists. Why is that?
Yeah, it's a fair point. They're often included because their role is so vital in, managing medications, counseling patients, and working as part of the whole healthcare team. They're not just dispensing.
Right, more than just counting pills.
Oh, much more. Their responsibilities are huge, giving drug info to patients and doctors, watching out for dangerous interactions between drugs, making sure all the regulations are followed.
So a real safety net role, too.
Absolutely. And increasingly, they're involved in things like pharmacogenomics, tailoring drugs to someone's genes, or running clinics for managing chronic diseases like diabetes. What's fascinating here is how this familiar role actually has so many layers of expertise and potential for growth.
That genetic tailoring piece is interesting. So given all that, the path to becoming a pharmacist must be pretty intense.
It is. It's a doctor of pharmacy degree, a PharmD. That involves a lot of schooling, plus extensive clinical rotations. Then you have to pass the big licensing exam, the NEPLX.
NEPLX, okay.
And of course, get your state license. Many also get extra certifications in specialized areas like oncology or pediatric pharmacy.
And the compensation reflects that doctoral level.
It does. Salaries are robust, averaging between $137,000 and $150,000 a year. And there are good paths for moving up into management, research, or more specialized clinical roles.
Okay, let's shift back towards the diagnostic side for number 4. Pathologists' assistants. What do they do exactly? They support pathologists, right?
Correct. They're highly skilled professionals who work alongside pathologists. They're essential for getting accurate diagnoses and planning effective treatments. Think oncology, forensic medicine.
So how do they support the pathologist? What's their hands-on work?
Well, they examine surgical specimens, you have
Right.
tissues removed during surgery, they might perform autopsies, and they prepare the tissue samples for the pathologist to look at under the microscope. If we connect this to the bigger picture, they're often the first eyes on the tissue, providing those key details that guide the medical decisions.
Almost like the first responders in the lab, gathering the crucial evidence. What kind of background do you need for that?
It requires a master's degree in pathologist assistant studies, and importantly, that program needs to be accredited by NAACLS, the National Accrediting Agency for Clinical Laboratory Sciences.
Got it. NAACLS accredited.
Yep. And then certification comes from the American Society for Clinical Pathology, or ASCP.
And the pay range for this role?
Average annual salaries are typically between $100,000 and $130,000. You might see higher pay in places like academic medical centers or research institutions.
Okay, number 5 takes us back into a therapeutic role, directly involved in treatment, radiation therapists.
Right. These are the folks who actually administer the targeted radiation treatments to patients, mainly for cancer, but sometimes other diseases too. They work very closely with the oncologists and the medical physicists.
So the dosimetrist plans it, the therapist delivers it.
Exactly. They operate the sophisticated machines like linear accelerators, making sure the radiation goes exactly where it's planned. But it's more than just technical. They're also monitoring the patient during treatment, checking for side effects, providing support, often seeing the same patients daily for weeks. This raises an important question about that blend of high-tech skill and, direct patient care.
The human element seems really key there. What's the training path?
Usually an associate or a bachelor's degree in radiation therapy, and most states require them to be licensed, plus certified by the American Registry of Radiologic Technologists, the ART.
ART certification, common in these fields. And salary.
Median salaries are around $100,000 to $120,000 per year, and again, potential for more with advanced certifications or in areas where demand is high.
All right, number 6 brings in some interesting science. Nuclear medicine technologists.
Yeah, this is a really fascinating area. They use radioactive materials, radiopharmaceuticals, and advanced imaging equipment.
For diagnosis and treatment.
Primarily diagnosis, but sometimes treatment too. They help diagnose things like heart disease, cancers, neurological disorders. What's fascinating here is how they use these nuclear processes to see how things are functioning inside the body, not just the structure.
Oh, okay. So different from an X-ray, which shows bones, this shows what?
It might show blood flow or how actively cells are growing, like finding a hot spot on a bone scan that could indicate cancer spread. They prepare and give the patient the radiopharmaceutical, operate the scanners like PET scanners or SPECT scanners, and are crucial for ensuring safety with the radioactive materials.
Handling radioactive materials sounds like it needs specific training.
Absolutely. You generally need at least an associate degree in nuclear medicine technology. A lot of techs actually have bachelor's degrees. Certification is common, either from the NMTCB or the ART.
NMTCB, Nuclear Medicine Technology Certification Board.
That's the one. And state licensure might be required too.
And the compensation for NUCMED techs.
Average annual salary is in the range of $85,000 to $110,000, and there are paths to move into supervisory roles or research.
Okay, number 7 is another imaging specialty, one people might be more familiar with because of the machines, MRI technologists.
Right, the magnetic resonance imaging specialist.
Yeah.
They operate those big scanners to get really detailed pictures of organs, soft tissues, bone, pretty much everything inside the body.
Essential for diagnosing so many things, right?
Oh, definitely. Everything from torn ligaments or cartilage in athletes to brain tumors to spinal cord injuries. Their role is critical. They have to position the patient just right, select the right imaging protocols on the machine.
And keep the patient calm, I imagine. Those machines can be a bit intimidating.
That's a huge part of it. Patient prep, making sure they're comfortable, explaining the process, ensuring safety, especially with the strong magnetic fields. This raises an important question about managing that patient experience in such a high-tech setting. The technologist is key to easing anxiety.
So technical skill plus patient skills. What's the education?
Typically an associate degree, either in radiologic technology generally or specifically an MRI. And while not always mandatory, certification from the ART is really highly preferred by most employers.
Makes sense. And the pay range.
You're looking at salaries between $80,000 and $105,000 per year, often higher in hospitals, busy outpatient centers, and definitely in major cities.
Moving on to number 8, still in imaging but using a different technology. Diagnostic medical sonographers. Ultrasound techs.
Exactly. These are the experts using high-frequency sound waves, ultrasound, to create images. We often think of pregnancy.
Right, seeing the baby.
That's a big part, but it's used for so much more.
Yeah.
Looking at organs like the liver, gallbladder, kidneys, heart, echocardiography, blood vessels. What's fascinating here is that it's non-invasive, no radiation, and it gives real-time images. You can see movement.
Like blood flow.
Precisely. They can assess blood flow through arteries and veins, check heart valve function live on screen. It's crucial for diagnosing clots, blockages, organ issues, monitoring pregnancies, even guiding procedures like biopsies.
That real-time aspect is powerful. How do they get trained to do that? It seems like interpreting those images takes skill.
It really does. Education is usually an associate degree or maybe a post-secondary certificate program, specifically in diagnostic medical sonography. And like the others, certification is key, usually from the ARDMS, the American Registry for Diagnostic Medical Sonography.
ARDMS. Okay. And the salary outlook.
Pretty strong. Average annual salaries run from $75,000 to $100,000. It's a field known for good job security and flexibility across different settings, hospitals, clinics, private practices.
Okay, let's shift gears away from imaging for number 9. We're looking at therapeutic communication roles now. Speech-language pathologists or SLPs?
Ah, yes. SLPs play such a fundamental role. They assess, diagnose, and treat communication and swallowing disorders.
And that's across all ages, right?
All ages. From infants maybe born with feeding issues or developmental delays, to kids with stutters or language problems, to adults recovering from strokes, brain injuries, or dealing with conditions like Parkinson's that affect speech or swallowing.
Swallowing, too. I didn't realize that was part of it.
Oh, absolutely. Dysphagia or trouble swallowing is a major area they work in. If we connect this to the bigger picture, think about it. Communication and safe eating are so basic to our quality of life. SLPs help restore those fundamental human abilities.
That sounds incredibly rewarding.
It really can be. They develop individualized treatment plans, work closely with families, teachers, other healthcare pros, and track how patients are progressing.
What's the educational requirement for that breadth of work?
It's a master's degree in speech-language pathology. Then you need to complete a supervised clinical fellowship, sort of like a residency, and get state licensure.
And certification.
Yes, certification from AASH, the American Speech Language Hearing Association, is generally required too.
ASHA, okay. And the pay for SLPs.
Median salaries are typically in the $85,000 to $100,000 range. Earnings can be higher depending on the setting: schools, hospitals, skilled nursing facilities, or private practice.
All right, we've reached number 10 on our list of highest paying allied health careers.
Yeah.
Audiologists.
Right. Audiologists are the experts in hearing and balance disorders.
So hearing tests, fitting hearing aids.
That's a core part of it, yes. Conducting hearing tests, diagnosing the type and degree of hearing loss, fitting and programming hearing aids or other assistive listening devices, but it's broader too.
How so?
They also manage and treat balance disorders, often related to the inner ear. They counsel patients and families on coping with hearing loss, prevention strategies. They might work with cochlear implants. This raises an important question about how they navigate the rapidly evolving hearing technology landscape to provide really personalized care.
That tech piece sounds huge now.
It is. Hearing aids are incredibly sophisticated now, often linking to smartphones, etc. Audiologists work with patients across the lifespan, from newborn hearing screenings up to older adults, and they collaborate closely with ear, nose, and throat doctors, otolaryngologists.
What's the required education to become an audiologist?
It's a doctoral degree, the Doctor of Audiology, or OD.
So it's a doctorate level now.
Yes, followed by state licensure. And like SLPs, many get certified, often through IESHA again, or the American Board of Audiology, ABA.
And the salary for an OD?
Salaries typically range from $80,000 to $100,000 per year. Again, potential for higher pay in certain settings like large medical centers, research, or running their own private practice.
Wow. So that's our top 10. We've really covered some ground, haven't we? Such incredible diversity in these allied health careers, but also you see the profound impact they have.
Absolutely. And the common thread, as we saw again and again, is that rigorous combination of education, hands-on clinical training, and then professional certification or licensure.
Right. These aren't just jobs you walk into.
Not at all. They really reflect the high standards and the specialized skills that the healthcare industry demands today. And, beyond the impressive salaries